Well, we made it into November, so celebrate. 2020's almost done. November, we're going to bring up the topic of Movember. And no, don't expect me to grow one of those ridiculous mustaches, although people doing it to remind people, as specifically men, to take care of themselves, that's something I can get behind. From maintaining a healthy weight to your mental health, guys, we're stubborn. We need that push to go see the doctor, and we bring on our friends from Mercy Health. Dr. DrBergsma joins me. Better Guest brought to you by ProTech Heating and Cooling. And talk about a better guest. Dr. DrBergsma is a radiation oncologist. He's here to talk about regular prostate screenings and safe treatment options if you do find an early diagnosis. Derek, thank you so much for spending some time with me.
Thanks for having me.
So who should be screened for prostate cancer? I'm talking age, risk factors, things like that.
Yeah, so in general, patients between the ages of 50 and 69 may benefit from prostate cancer screening. Some patients who have African American ancestry or a strong family history of prostate cancer, say a father or brother who had a diagnosis less than 65 years old, they may benefit from starting sooner at like 40 or 45. And then sometimes men with over 70 to 75 may benefit as well if they're extremely healthy and have never been screened before. But really, it's important to talk to your primary care doctor about your prostate health, your family history, and the risks and benefits of prostate cancer screening.
Well, let me ask you this question because, with breast cancer, you feel a lump, and that's kind of your sign. Are there any signs or things to be aware of as a guy that you should be aware of?
Yeah, so a little different in prostate cancer because the vast majority of men are diagnosed when they're either asymptomatic or sometimes when they're symptomatic, they're having trouble urinating. That usually indicates a more aggressive tumor or advanced tumor, or it just could be benign, non-cancerous prostate issues. But the mainstay of screening, which is to pick up cancer early, it uses a PSA blood test and then possibly a digital rectal examination performed by the provider.
Okay, and then let's go through just some of the options for someone who is diagnosed with prostate cancer. They do their screenings, they try to get ahead of it, and they find out they've got it. What next?
Yeah, so really you have to figure out how advanced and aggressive the prostate cancer is, and that involves kind of the rectal exam, the PSA level, and the Gleason score, which is actually a score that is based on the cells that are obtained from a biopsy. So first of all, if the PSA is elevated or there's concern for prostate cancer, you'd have a biopsy typically done by a urologist, and then they would kind of use all that information to figure out how aggressive the cancer is. And then in the case of more aggressive cancers, sometimes additional imaging studies are done like a bone scan or a CT scan depending on the concern.
And now you were telling me that you guys have something at Mercy Health. Again, this is Dr. DrBergsma, radiation oncologist. You were telling me there is this cyber knife, and that sounds cool. It's also hopefully helpful. Tell me about that as one of the treatment options.
Yeah, when you're diagnosed with prostate cancer that's localized to the prostate, meaning it hasn't spread, which is certainly the most typical case, there are multiple options, and they may include actually active surveillance, which is not active treatment, but it's closely monitoring the PSA levels, rectal exams, and intermittent biopsies. Or a patient may choose to have active treatment, and that include surgery, typically with a robotic prostatectomy or radiation therapy. And radiation therapy has many different types. It could include an implant of radiation that is either permanent or temporary, or external radiation given by a machine called a linear accelerator. And that external radiation historically has been kind of daily for a number of weeks, up to 8 or 9 weeks. But more recently, we have good evidence that this treatment can be delivered in a faster period of time of 4 to 5.5 weeks, 5 days a week. And we actually have this machine called the CyberKnife, which is one way of delivering an ultra-fast regimen of radiation where you get 5 treatments every other day over about 2 weeks. Treatments are pretty quick each day, just a few minutes. And the CyberKnife is a way of doing that is actually extremely precise and accurate, and we have that as an option for patients. And we think very highly of it, and it does an excellent job.
And again, we're talking about this stuff, and it can be scary, right? Cancer can be scary. But the reason we're talking about this is so that people have a level of knowledge and comfort and stress to people. Be ahead of this, because you would know the numbers better than I would. But if you catch prostate cancer early enough, what are we looking at in terms of mortality rate?
Yeah, that's a very good question, and it's actually important because it factors into screening. A lot of men historically who were screened at very young ages were found to have very indolent prostate cancers, which means that they may never cause problems. Or in older men who have other competing health issues, they may get a prostate cancer diagnosis, but the prostate cancer would never cause problems in their lifetime. So the vast majority of men are diagnosed with localized prostate cancer that if it requires treatment has a very high likelihood of controlling it for the rest of their lives. And really it comes down to kind of risk stratifying those patients. But I tell people, even with a diagnosis of prostate cancer, it's very likely that you'll live out your life to a normal age.
And that's the encouraging thing. Anything else that guys should be aware of? Again, the topic of Movember, keeping men's health top of mind here in November. What other things would you tell guys listening right now?
Yeah, I'd tell them talk to their primary care doctor about if they should be screened. And then if they are diagnosed with prostate cancer, it's important to get input from potentially multiple providers. You'll typically see a urologist. It may be worthwhile to ask about radiation, and there are a lot of options even within those different types of treatments. And ultimately, the decision about what treatment to pursue is an individual one that is based on the risks and benefits of each treatment and kind of the side effect profiles that the patient may be more okay with.
This has been a crazy year for people's health, and we have looked to Mercy Health to be kind of our go-to to keep people healthy in what is a very difficult year. For guys, it's whether it's maintaining healthy weight, mental health, or that bigger push to see the doctor. Dr. DrBergsma, thank you so much for coming on and helping spread that message, because I know, guys, we're stubborn. We don't like doing this stuff, but I hope being more informed and being reminded, maybe even nagging, I'll nag a little bit. I'm hoping that's the difference in saving someone's life. Thank you so much.
Thanks for having me.
That CyberKnife stuff, I'm telling you, I ended up Googling it earlier this year because that's what you do. You assume the worst when you have a health scare. I ended up having a prostate infection and had some symptoms that you start Googling and you assume the worst. But I ended up going to see a urologist and had medication. And you realize, like, dude, hey, your prostate health, you got to be aware of that. I'm in my 20s, and it's something I'm going to be aware of for the rest of my life. It spooked me a little bit, but I think that's sometimes what we need, that necessary kick in the pants as guys. So I'll stress that for this month and really for every month. Take care of yourself. Go see a doctor if you have any concerns, because ultimately you want to catch something early. You don't want to catch it late. And folks over at Mercy Health are part of that push to make sure that we're all living a healthier life in 2020, as healthy as we possibly can, staying as safe as we can.